All right, y'all, we're popping, and today we're going to be talking about some stir that has been happening with the Black community for the past few weeks when it comes to one of our own, Dr. Jackie Walters and her comments on Black maternal health in the nation. Now, if you don't know who Jackie Walters is, she basically is an OBGYN on Married to Medicine, Basketball Wives style show that really showcases Black women who are doctors, Black women who are married to doctors, and Black women who are just in the medical community in general. And this is a clip in question. Now, to give y'all a primer about the clip, basically she was on a live show with her co-host, Dr. Heavenly. Basically, she a dentist in Atlanta, and basically they were just going back and forth. A question came in saying that why do Black women have a higher mortality rate, and when giving birth and all that.
Now, I wish we knew the answer, and I will not allow myself to say it is health disparity only.
Mm-hmm.
When same thing we're seeing with the CV, as you've told me, we have to say is we as a race have more comorbidity. Care is important. Crazy enough, we still see patients come into the hospital who that patient has not seen a doctor her entire pregnancy. Sometimes, as African American women, we're a bit more dramatic.
And this is the part where you need to listen
You go
to.
to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
And that's what, people got flamed for her saying that. And the reason that's such a big question is because Black women face a higher mortality rate when it comes to like giving birth. And a lot of times, people have tried to attribute it like, oh well, Black people don't eat healthy, Black people don't see doctors, Black people don't do all that, which is a lot of systematic issues that I'm gonna get into in a second. But even when Black women see doctors, even when Black women make enough money to go get a doctor, get a quality doctor, whatever, they still have a higher mortality rate across the spectrum, even if they the most fittest, healthiest. Like, picture what we want to like picture Black excellence as. And so maternity rate is such a big big issue we have in the nation when it comes to Black women. She actually did a talk with Kamala Harris on this very issue. And so basically, as you can see in the caption, Black women are 3 times more likely to pass away from childbirth in America. This is inexcusable. At The Real, Jackie and I discuss our nation's maternal health crisis on tonight's episode of Bravo's Married to Medicine. But you see kind of like the hypocrisy she kind of had within the 3-year time period, because in that clip she was just saying like, well, it's on Black women, like cry wolf, it's insensitive, basically saying the same things that white doctors have been saying for many years. But now she's actually realizing and saying that, hey, there's a lot of systematic issues going on. Because for one, Black patients in general, are more likely to get their pain dismissed because white people automatically think we have a higher pain tolerance. But going back to Black women who are like actually getting pregnant, going through prenatal care, whatever, whenever they bring up issues, whenever to the doctors, a lot of them have, has said issues of just like, hey, I'm experiencing this. Is this normal? And the doctors keep saying yes, 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 even if the symptoms keep getting worse. As well as the fact, if you're in a nursing room, like they wait till the very last minute to actually do something and take care of the situation, because they don't think life is valuable for Black women as they do for white women. So I've had Black peers, Black friends, Black family members. I've had a mom who had a lot of complications during her pregnancies, in the past, that she still hasn't necessarily just recovered from. As well as there's certain lack of disregard that is shown by not only just like white nursing staff, but like medical professionals in general. Because not only if there's racism involved with it, but there's also ego involved with it. And it's just like doctors often feel like they know better than the patients, and they feel like the patients, like Dr. Jackie said, was crying wolf, when in actuality they're actually saying something, they're in pain, and you need to make sure that you do the best you can to make sure your patients are fine.
This has kind of felt like the straw that broke the camel's back. So in 2016, when I moved to Atlanta and I was pregnant already, expecting my son, when I was looking around and asking friends at the time for OBGYNs, everybody recommended Dr. Jackie. So, of course, I didn't know who she was, but I'm like, well, she got to be good if all y'all are going to her and there is no connection between these ladies that recommended her, so let me go to her too. Long story short, my son ended up being a stillbirth 36 weeks in my pregnancy. 3 days after I had my appointment with Dr. Jackie. 3 days later, I'm having these pains. I'm thinking they're Braxton Hicks. I didn't know what was going on. So I called Dr. Jackie's office to let them know. I'm told, drink some orange juice, keep doing this and that.
Drink some orange juice, bro. What type of home remedy is that? Like, if you're having pain, like, you need the best advice is go to the doctor.
So that's what I did, and it still didn't feel well. A couple hours later, fast forward a few hours later, I'm at the hospital. I'm a couple days shy, 37 weeks pregnant, and I'm told that there is no heartbeat. So to hear a woman, I've been quiet about this story for a very long time. And when my mom touched down into Atlanta, my mom had a lot to say to Dr. Jackie, a whole lot to say to her. But to hear a woman like that, of her caliber, of her demeanor,
exactly,
make such a poor comment that Black women cry wolf.
And it's not to say rip all Black doctors, because I feel like you generally get better care from Black doctors. Maybe not Dr. Jackson case, but I don't blame her how she feels. Because for her to use her platform and make such a poor comment, like I've said, it dismisses the experience of a lot of Black women that actually take care of themselves, that actually do what they need to do, that actually get the OBGYNs, prenatal care, also double check, do research and all that, you know, prepare for a baby. For our experienced doctor to say, oh, just drink some orange juice, when it's just like, you could have like really just like helped like actually save the baby, you know, a long time ago. Like, you know, it's very sad and disheartening. Like, we still live in days, and it just really shows that, you know, the way that the healthcare system is set up is not really meant to help like patients. It's just to make money and profit and all that. And not saying Dr. Jackie is like solely doing that for that reason, but it's just like, you know, that's just how the healthcare system is designed.
See, y'all should have known from that sad ponytail, she was not to be trusted. Because the way that these people are bringing out their story times about Dr. Jackie, a mess. Let's get to her story time first.
I chose Dr. Jackie because, you know, she's in the Atlanta area. She was a Black female doctor. And knowing, like, the high mortality rate with Black women during childbirth, I wanted to feel protected, so I wanted a Black doctor.
As you should, yo.
But honestly, this was the most traumatic birthing experience I could have possibly thought I would have went through. To make a long story short, the day I turned 38 weeks, Dr. Jackie decided to induce me because they thought my baby had a low birth rate, meaning they thought he only weighed like 5 pounds. I went to the hospital that day, not knowing that I was going to be spending the next 3 days in labor, in excruciating pain.
3 days.
Not only was it painful for me, it was painful for my child because his heart rate was going up and down, up and down, up and down, with them trying to exhaust every option they could to get him out of me. So when all their methods failed, they ended up telling me that I had to have an emergency C-section because his heart rate had got too low. And y'all, when I tell y'all I was bawling from the moment they told me to the moment they put me on a table, crying, couldn't talk. I didn't even open my mouth.
Now peep the comments on this video.
That is crazy.
Somebody by the name of Leani, I hope I'm saying your name right. Leani Johnson says, OMG, I think I'm ready to tell my story. I will never go back to the Northside Hospital or back to Dr. Jackie. Very traumatic experience. Somebody else says, I have a story too.
Wow.
Dr. Jackie didn't show up to my birth because she didn't take my pain seriously and I almost lost my son. Another girl by the name of Danny Ferry says, Dr. Jackie was my doctor too, and I only seen...
So to verify these, I don't know what way is to verify them, but it's just like, for this certain experience, I don't think people are just gonna generally just make this up. Like, this is a serious allegation, and you know, Dr. Jackie, I feel like she did type to sue some people. So it's just like, I don't think like people are fibbing about this, especially when you have so many different people experience their stories in so much detail. Like, there's stuff you can't fake it, because her story, other story, you know, like videos I've been trying to do research for this video, they had a similar story that like my mom, my cousin, you know, a lot of people in my like circle have had. So it's just like, there's something that you just can't fake, and this is very appalling. I went to this office maybe 5-6 times in the beginning of my pregnancy. Out of all of those visits, I saw Dr. Jackie twice for all 2 minutes. In my opinion, she's very insensitive, sarcastic, and her bedside manner is poor. She makes sarcastic jokes while telling me something could be wrong with my child, which infuriated me. I later withdrew and went elsewhere. Overall, she's a good person, but my experience with her is not personal at all. I don't feel like I'm receiving the proper prenatal care as I have in the past. With my last OBG doctors, my wait is always long. When it's time to see her, it's always quick. It's like she doesn't take the time to make experience as her patient feel personal. I'm very disappointed. I definitely would not recommend Dr. Jackie. I was under the impression I was seeing a good doctor that cared. I only saw her maybe twice during my pregnancy. Her nurse saw me every time and was awesome. She didn't even deliver my baby. Dr. Casilla did. She seems to only care about celebrities. Don't be fooled in the name Dr. Jackie. The visits were not even thorough. The times I did see her, what a waste. This was dated in 12/23 last year. For you to do a Google review, like, it takes time. Like, yeah, you can hop on TikTok and make the comments or whatever, but to fill out a Google review, like, something had to be up, you know. Maybe I should have read the Google reviews before scheduling. Found her on my insurance provider list, new to Atlanta, and needed a GBGIN. She was in and out of the room very quickly, had no bedside manner, definitely did not read my chart outside of the breast cancer history, questioned why I wanted to have kids, advised I wasn't ready and that my husband I need counseling. I went her 5 minutes exams. You just say I will not be returning, but appreciate the genetic testing her office provided. She definitely didn't seem to care about me. I expected the appointment to be discussion to history, especially as a new patient. Nope. And so that's just a little snippet of like what, you know, a lot of patients have been saying about Dr. Jackie, and you know, it's not looking good. This is like very much sad beyond, you know, belief. And it's just like, even today when we have black professionals, like how much we try to get more black people into the space, we oftentimes have to realize that, you know, even like all skin folk is not kinfolk. People are there to make a bag. People are there to like get the prestige, the whole, you know, facade of being a doctor trying to save America's health, when it's just like they probably don't care for their patients at all. So that's something to just be aware of. It's just, you know, I hope this be more of a lesson, just like how to be more weary about who we asked to speak for our issues. So with that being said, that has been Pop Episode today. Please like, subscribe, turn on post notifications, comment down below how you feel about the situation. I know this has been garnering a lot of attention. Please don't say no hate to Dr. Jackie's, you know, way and all this, but at the end of the day, it's just like we need to hold accountability when it counts. So just comment how you feel about it. Well, other than that, stay warm, stay frosty, depending on what part of the country you're in. Here's a video for you to go see, and peace out.